rinse water, we apply this bond, purificate universal bond, and because this universal bond doesn't need to liqueur, no need liqueur step, you only need to apply air dry and apply composite and polish, and this is before and after. We give back the aesthetic very simple way, and patient very happy to pay the money. Doing bleaching, you will decrease the tooth color. The patient, they want to more aesthetic, because especially in this COVID, everybody, well, the ladies especially, they have clothes, but they cannot go out. They make up, nobody see during COVID. So they will try to make aesthetic with the teeth. So bleach, and then just this was placed with the A2 shape and looks very nice. Simple way and high aesthetic. You don't need to grind the teeth, no need. Because when the patient gets old, you still have your natural tooth in the mouth. Okay? That is a big advantage for minimally invasive concept. This is another case by Dr. Bruno Ferrari in Brazil. This is before and after. Okay, he just used A2 shape and fixed it. Very simple technique, and the patient happy to pay. Usually the target is more between men and women. I consider that women like more beautiful. So most the ladies prefer, they have that desire to do bleaching. Okay, and we give back the smile design and aesthetic. And this thin layer veneer is 0.2 millimeter. It's very thin layer, but having this high good bone strength, we use self-etching technique. We etch, rinse water, and with composite, good quality composite, you give back the aesthetic. Okay, how about this case? Fracture. To improve this clinical case, again, I believe Vietnamese dentists also now in the world very popular with the selective etching technique. So the concept with selective etching technique is we etch in the phosphoric acid with the uncut enamel area. This border area we will not etch, we just etch in the uncut enamel area. We rinse water, air dry, apply bonding, then we also in the palatal surface, okay, we etch this area, and we extend bonding, and we extend composite also, okay. This we place the first layer. Actually, this technique was with the mock-up technique. Okay, I didn't put the silicone key picture, but this was with the silicone key. We make the first layer with composite, and like here, and next layer composite, next layer, layer by layer, okay, and polish and looks high aesthetic. Okay, if you really want to become like this kind of high aesthetic restoration and keep preservation, because our duty as dentists, we want to preserve healthy enamel and dentine. Not all cases, oh, zirconia crown, zirconium veneer or porcelain veneer, no. Because once you grind the teeth, there's no way to come back. The tooth shelf life becomes shorter. We are destroying the tooth. So we want to preserve. And having this good bonding, good composite, and looks very nice, right? When the patient gets old, he still has his good condition tooth in the mouth. Well, composite resin, how we always said we give back aesthetic, but how to give back aesthetic? Because composite resin has a lot physical property. But it's not about durability, shrinkage. We as dentists, we want to give back the aesthetic. The most important is the filler, but the filler shape. You can see here, all this is irregular filler shape. And this is the only one with 100% spherical filler. When it's 100% spherical filler, the glossiness is last more longer. I have made a clinical follow for 5 years, 10 years. I did not repolish, no need to repolish, and the glossiness still there. The color, no change. But with this irregular type composite, I think every 2 months or 3 months, I need to repolish the composite. Why? Because we brush the tooth every day. Those particles will start to come out. So when the irregular filler particle come out, the tooth surface become rough. When it's rough, you drink coffee, juice, they're easy to stain to those juice. So it change color naturally, and glossiness become less. But spherical filler is different. It keeps long-lasting glossiness and color no change. So composite is kind of ceramic family. Okay? Not all clinical case you need to do ceramic. Ceramic is 100% by silica zirconia. That's why very hard. But composite resin, it contains also silica zirconia. And the percentage is lower. So this kind of product we call composite resin. So having good composite is enough. You don't need to go for high, if you make a ceramic, you need to grind a lot healthy structure. But with composite, you don't need. And this composite, Palfica LX5, is usually I use a lot for aesthetic purpose. And this composite, when you do the condensation, it's not sticky to the instrument. Very easy to sculpt and manage. Okay, and this has like here, each layer 10 seconds. It has good chameleon effect. It reduces your working time. In this case, because it has chameleon effect. So in this case, the tooth is is elder patient. Instead, if I use traditional composite, I might use dentin shade, enamel shade, 4 or 5, opaque shade, okay, many shades. But with the Palfica LX5, in this case, I place OA3, opalescent shade, just one shade. It gives back this aesthetic. It reduces your working time. You don't need to worry to work with color matching, shade matching, no need. You just fill in with OA3, and layer by layer, it reduces your working time, and you give back high aesthetic. And how do we do class 2 restoration in Japan? We use this latest composite, this one. Flow composite combination with a paste type composite. We place bonding. After we place bonding, we put the metal matrix, okay? Metal matrix, just image, we place metal matrix. And with this latest flow composite, this is universal type flow composite. If you have big cavity, flow, all cavity with flow composite, no problem. Because this has high strength, high filler content, and good good strength. It's improved. This is the newest, latest flow composite. Like here, only 10 seconds. So we will inject this small amount. We like here inject, and you don't need to condense. Instantly you will build up in the proximal wall, convert class 2 to class 1. And the remain you fill in with this Palfic LX5 and looks very nice. Okay, you don't need to condense with this flow composite. This Palfic universal flow has 3 flowability: super low flow, medium flow, and high flow. For example, this Palfic LX5, the strength is 400 megapascal strength, hard strength. This flow composite has 430 megapascal hard strength. It's harder than the paste type composite. Okay, so if you have big cavity, all with the flow, no problem. Okay, I brought this latest information. What is the innovative composite is coming now in the world. This was launched during COVID. Usually any company composite, they have many shapes.